Okay, great. Good afternoon, everyone. We're going to begin our joint city Nueces County press briefing on COVID for today, which is the 27th of April. And so just as a quick recap, we said last Friday that we have been working with the community for about 7-8 weeks. So today marks either the 8th or 9th week, depending on how you count. But we'll be here this week providing information to the community with response to COVID-19. And today, joining me is Annette Rodriguez, our Director of Public Health, and she'll talk today about the drive-through testing site and activities that took place this morning. We had just under 100 persons that were tested at the drive-through site. Mayor McComb is here as well, and he'll talk about reactions to the governor's orders that came out today. He had 3 separate orders that were released. And the mayor's doing a few things for some of our local orders. In particular, he may speak on short-term rentals and as well on some of the beach measures that we had in place in our orders. They may be modified today. I'll let him speak on that. And then Nueces County Judge Barbara Canales is here with us as well, and she'll similarly talk in terms of reaction to the governor's 2:30 press briefing and the 3 orders that he issued, and as well she'll tell us how that impacts Nueces County and the orders that the judge did. Okay, so every day at 4 o'clock we look at statistics from the prior day, from a 24-hour period to see number of new cases, number of deaths, number of hospital stays, that type of thing. And so I'll begin with that. So yesterday at 4, we had an update, but 24 hours from then, today we have an update, and we have 5 new cases to report today in the past 24 hours. So that brings our total persons that have been impacted over the several weeks to 99. So we're just one shy of 100 with today's 5 confirmed cases. All 5 cases are from Nueces, from Nueces County, but from the city of Corpus Christi. And I'll explain later in the testing, or repeat it later, but 3 of those 5 were from private labs, and then 2 came from our own testing at our lab. Now, last Friday when we were here, we only had 1 death that we were reporting, but there was a new death reported on Saturday and another death reported on Sunday. The Saturday death happened before Saturday, and it's a person that has a permanent residency here in the city of Corpus Christi, but they've been away for almost 2 months. He was a traveling nurse, and he was in Nevada. And so the guidelines from the federal government are that the place where the person resides in a permanent residency, that's the location where the death has to be counted. And so we reported that out on Saturday, but I'm just repeating it here in case we have some first-time watchers or listeners. And so the Saturday death was from a young traveling nurse who was actually in Nevada for the past 2 months or so, but does have a home here. And so we're going to count him as a death in Nueces County, Corpus Christi. And then on Sunday, we reported a death of one of our longest persons that had COVID, and he was a Corpus Christi resident. And so that brings our death total to 3 for Nueces County as of today. The number of male and female cases still remain somewhat equally distributed. There's 52 males that have had or have COVID, and 47 females. Those additional 5 that we picked up since yesterday, 4 of them were male and 1 was female. When we look at the age group, we report that every day, and that's on our website as well. It's pretty evenly distributed in the 6 age categories of 20 to 79. The 5 new persons, 1 was a 20-year-old group, 2 in the 30-year-old group, 1 in the 60-year-old group, and 1 in the 70 to 79-year-old group. And then when we look at testing, which is important, we know that's something that's talked about nationally, and as evidenced by our private testing as well as our own, we're doing more testing here in Nueces County. Today, while we did 95 tests performed in the drive-through operation, you have to take that material and then analyze it in the lab. And the number I'm going to tell you is what we analyzed in the lab. And so today we analyzed 43 specimens in our labs. And then the hospitals, clinics, and physicians reported to us that they had 46 tests analyzed since yesterday. So 89 tests in total from both us and the private sector. That brings our total testing to date of over 2,000, so 2,192 to be exact. Let's look at the number of hospitalized. And so at any one time since the beginning of this COVID epidemic or pandemic, we've had 21 persons hospitalized in our county. Today, there are 3 in the hospital, 3 patients in the hospital, and one of those 3 is in ICU. One important thing to note is our recovered rate keeps increasing in a positive way. So of all those persons that have had COVID-19, the 99, 39 have recovered, or 39%. So that number's that slice of the circle is getting bigger, and that's what we like to see. And then the overall picture of where are the persons that either have had it or have it today in Nueces County, where do they live? And so 84 live in the city of Corpus Christi, and then we have 2 that live in Robstown, 7 live in Port Aransas, and then 6 live in rural Nueces County for a total of 99. Okay, so that's the statistics. Those, again, are reported every day, and they're on our website as well. And I'm going to do another quick update on our first responders. This information also was through the weekend, pretty rapid changes. And so on Saturday, I believe it was Saturday, 4 first responders, our fire, paramedics, who were attending to a person that was under cardiac arrest, adjusted their goggles slightly. One removed them so they could see when they were putting an IV needle in. Another one, on the way back to the ambulance unit, made some adjustments to his. And so upon review and work with our health department, it was deemed that we probably should put those firefighters in isolation until we get the test results from the cardiac arrest patient, who, upon getting to the hospital, it was determined that he may be a candidate for COVID-19. Fortunately, he was tested pretty quickly, and the results came in. So by Sunday, given that he had negative results, we were able to release those 4 firefighters from isolation. So at this point, we have 0 firefighters and 0 police officers in quarantine, which is good. And then finally, my last part to update today is we want to remind the community, both the business and residential community, that the city has some pretty well-funded programs for them to utilize if they need to. The City Council approved close to, or a little over, I should say, $2.5 million for a small business loan program. That's a loan program that has 0% interest for the term of the loan, which can be up to 3 years. And the first 4 months, the payment is deferred. The Lift Fund Incorporated, that we've had a working relationship for 15 years, it's a micro lender, is the agent that we're using to administer these loans. They have an 888 number, 888-215-2373. And the application for that small business loan is online at liftfund.com, liftfund.com. And so they're still taking applications, even though more have come in than what funding is available. Some of those applications are pending paperwork. It's important that what's needed is actually turned in. And so it may not be too late if somebody has all their financial and other paperwork together to get funded. So look at that number and check out on that website. These loans are up to $25,000, and they will help a business get through this time. And then for our residents, whether they're renting or if they own a home, if they need help paying their lease or their rent or their mortgage, the City Council approved $1.6 million, $800,000 in each category for renters and then homeowners. The Salvation Army or Corpus Christi Hope House, either of those entities will help a resident to get assistance. The assistance is for rent and mortgage, but it's also for utilities. And so $800,000 has been allocated to each homeowner/renter, but either of these agencies can help either a homeowner or a renter. And so the Hope House number's on that screen there, but it's 361-852-2273. And then the Salvation Army number is there as well, 361-884-9497. So either of those a resident can call. We've had longstanding working relationships with these two entities, and we have similar programs that go year-round. What we did, though, for this pandemic is increase their funding to $1.6 million to help renters and persons with a home, and then also with utility bills. So that concludes my opening remarks. We're going to have Annette Rodriguez, our Public Health Director, come up now and speak a little bit about some of the health precautions we still need to follow, and talk about today's drive-through testing as well. And then both Mayor McComb and Judge Canales will speak to us about the reaction to the Governor Abbott's orders that were issued and how they impact us here locally.
En resumen, en las últimas 24 horas han sido 5 los casos nuevos por el coronavirus. Actualmente en el condado de Nueces existen 99 casos confirmados. Entre esos, 52 son varones y 47 son mujeres. La mayoría se encuentran en el rango de edades entre 30 y 39 años. En total se han llevado a cabo 2,192 pruebas entre hospitales y el Distrito de Salud Pública. De los 99 casos, 84 son residentes de la ciudad de Corpus Christi, 2 son residentes de Robstown, 7 son residentes de Port Aransas y 6 son residentes de áreas rurales. 39 de los 99 casos se han recuperado por completo, 21 han sido hospitalizados, 39 han sido dados de alta, 3 continúan en el hospital, 1 en condición crítica en la unidad de cuidados intensivos. Hasta la fecha son 3 las personas fallecidas residentes del condado de Nueces. En cuanto al Departamento de Bomberos. 4 bomberos del Departamento de Bomberos fueron colocados en aislamiento el sábado 25 de abril después de que se determinó que un paciente con paro cardíaco fue transportado al hospital quien contaba con criterio para el virus. Ese equipo respondió a una llamada de un paciente que experimentaba los problemas cardíacos. Los bomberos llevaban equipo de protección personal como lo indica su protocolo. Durante el tratamiento y el transporte del paciente, los bomberos hicieron ajustes en el equipo de protección personal. Como medida precautoria, los 4 bomberos fueron aislados en espera de los resultados de la prueba del paciente. Tras llevarse a cabo esa prueba, el paciente resultó negativo y los bomberos asumieron sus deberes a partir del domingo 26 de abril. Sobre los préstamos para pequeños negocios, en la última semana han sido 242 las aplicaciones de préstamos presentadas por pequeñas empresas locales que han sido impactadas por los efectos de la pandemia. Un recordatorio para aquellos que solicitan un préstamo: envíe toda la documentación necesaria llenada correctamente para acelerar el proceso de revisión. Los propietarios de pequeñas empresas locales que busquen asistencia deben llamar al Lift Fund al 1-888-215-2373. 1-888-215-2373. Para los residentes que soliciten ayuda para el pago de hipotecas o servicios, existen fondos diseñados para ayudar financieramente a aquellos residentes que han sido afectados por la pandemia. Pueden asistir ya sea al Ejército de Salvación o de Hope House para recibir esa información. El Ejército de Salvación está ubicado en el 513 de la calle Josephine o llamando al 884-9497, o The Hope House, ubicada en el 3226 de la calle Reed o llamando al 852-2273. El Departamento de Vivienda y Desarrollo Comunitario de la ciudad administrará y supervisará directamente esos fondos.
Thank you. Annette Rodriguez, Health Director. Our drive-through today went very well. We had 95 specimens collected, and we continue to see a rise in the number of appointments for these drive-throughs. Our next drive-through will be this Thursday at 8 a.m. We did receive the 500 test kits that the state said that they would send us from the Texas Department of State Health Services on Friday afternoon, so we are very grateful for those test kits. Those include the VTM and the swabs that we need to continue to test individuals in our community. I want to take a moment to recognize nurses, doctors, and other healthcare workers that put their lives on the line daily to help save others. You are my hero, and I think it's safe to say the rest of the community feels the same way. I also want to say thank you to our local health authority, Dr. Ramachandruni. He actually goes out to see our COVID-19 patients. He is an infectious disease specialist, and I want to say a special thank you to him for the work he does day in and day out. As the economy begins to reopen, we recommend that you continue those non-pharmaceutical interventions that we've been talking about every day, such as washing your hands, social distancing, disinfecting commonly touched areas, and reminding yourselves not to touch your eyes, nose, or mouth to infect yourself. If these measures are not continued, we will see increases in COVID-19 cases, and the health district is fighting every day to keep this from happening. The reopening of the economy does not mean that things go back to normal. Far from it. It means that we do everything in our power to social distance and wear a mask so that we can stay safe and protect ourselves and others from this terrible virus. Please do your part to stay protected so that we can protect the rest of our community, especially those that are vulnerable. It is important for you to continue to wash your hands with soap and water for at least 20 seconds. And again, stay healthy, stay protected, and stay informed by visiting www.cctexas.com/coronavirus. Thank you.
En resumen, el día de hoy tuvimos otra exitosa toma de especímenes. Fue un total de 95 y seguimos viendo un aumento en las solicitudes. Quiero tomarme un momento para reconocer a las enfermeras, los médicos y demás trabajadores de la salud que arriesgan sus vidas diariamente para ayudar a salvar a otros. En especial al Dr. Ramachandruni, quien ha visitado personalmente a las personas afectadas por el virus. A medida que la economía comienza a reabrirse, le recordamos que continúe tomando todas las medidas de prevención posibles para evitar contagios, como lavarse las manos, distanciarse socialmente, desinfectar áreas comúnmente tocadas y evitar tocarse los ojos, nariz o boca con las manos sucias. La reapertura de la economía no significa que las cosas vuelvan a la normalidad. Significa que hacemos todo lo que está a nuestro alcance para mantener la distancia social y usar protección para protegernos a nosotros mismos y a los demás de este terrible virus. Manténgase informado visitando www.cctexas.com/coronavirus.
Good afternoon, everyone. I'm Barbara Canales, Nueces County Judge, and I'm here to tell you about a very important event that happened earlier this afternoon. In fact, while we were actually in Commissioner's Court, we took a recess for Governor Greg Abbott's press conference in which he announced some new protocols for us coming really to us on May 1st, which is Friday. So let me tell you that what I'm about to announce is going to take effect on May 1st. That's because his orders, stay-at-home orders, were through April 30th, as were ours in Nueces County, and you'll hear the mayor talk about the city of Corpus Christi, and he's going to let those stay-at-home orders lapse, which means we're coming into the beginning of phase 1 of reopening Texas business. And so as of May 1st on Friday, retail, restaurants, malls, stores, everybody that was considered non-essential except no bars, gyms, or barber shops, saloons, or tattoo parlors, those will still have to stay closed during this phase 1 time period. But during this phase 1, those other non-essential stores can begin to receive in sales or customers going in and continuing. They're going to be opening up their business. Remember, we were in that retail to-go phase, and now we're moving into a new phase. There is a caveat, or there is I suppose, a limitation, and that limitation is 25% of capacity. That's going to be important as we ask our business partners in our community to help us maintain that those parameters as they are put there for our health and safety. In addition, social distancing, like our health director said, does not go away. We're not going to wake up on Thursday and have anything different, or excuse me, we're not going to wake up on Friday when all these events happen and COVID has changed its pattern. That's not going to happen. So while we're changing our patterns, we're going to have to take on more personal responsibility. And I know we can do it. You know why I know? Because I know how important it is to make sure that our economy survives. And because we want our economy to survive and we want to support this phase 1 opening, it's going to be incumbent upon us to take it very seriously that we can maintain the social distancing and keep to these parameters of 25%. In the question and answer period that followed the press conference, there was a very important question that was asked. And they said, Governor, if we see the numbers go the other way, what will you do? And he basically responded, to paraphrase, that he would also respond in kind. So as they say, you've been given an inch. Don't take the mile. Take the inch, because it's the right way to reopen. It's the responsible way to reopen. And more importantly, we don't want to see a surge. I must tell you that as we see 5 cases come into our community, you'll recall we were at 0, 0, 0, 1, 2, 2, and 5, and we only have half the test complete. We must take this as a solemn warning that we have to continue to be strong, stronger than we've ever been, because now we will have the temptation to say things are back to normal. They're not. They're not back to normal. This is our attempt to save us from the second disaster. And so I'm going to be very vigilant with you about making certain that these 25% capacities are honored and that social distancing is honored. This also applies to museums or movie theaters as well. So again, if you have questions, that 414-6000 number, I have a feeling the hotlines are going to be ringing, but we can help answer your questions. The governor also discussed quite a bit about where we were headed with sports. At this time, we're still looking for those sports to be conducted in series of 4. So you can think about anything you can do that moves 4 people. That would be permissible at this time on Friday, but he's still asking for social distancing. Some of the things that I know are going to come up is, what am I going to do with our orders? We are going to mimic the governor's orders, and we are going to make those changes tomorrow. Remember, we have until Friday for them to be enacted, so I would like to tell you that I literally left the bench to come over here, and so I will be writing tonight, and tomorrow I'll be collaborating with the city attorney and the county attorney. We've always been collaborative, and I want to tell you how important that is and how somewhat unusual it is. Not that people don't always get along, but that it's so important to do it simultaneously. Why? So we create consistency and we lessen confusion. So again, the governor's stay-at-home order expires on April 30th, and we are still minimizing our social gatherings. I think it's also important to know that the governor has created a handbook for Texas with regards to reopening. I'm in the process of downloading it and getting it up on our website. Give us till tomorrow, but we'll absolutely have that handbook available for Nueces County citizens, available on our website. I think this is going to be really important because the handbook is going to be your manual for and your guidance for retail and for your customers and for your employees. And again, having it available on our website is just such a great tool for everybody. Let me just call on everybody here in Nueces County and all our regional neighbors to join me in calling for all of us to act responsibly as we re-engage in our economy, to continue to follow the health and sanitation guidelines that have been outlined so perfectly by our health director today. And please, let's care for our most vulnerable neighbors. I have a granny. Everyone's got someone they love that's elderly. Please, it's for them more than any other population. There are other vulnerable populations that I'm highly concerned about. But during this time when we reopen and we have this sort of itch or this urge to want to just get out there because we've been staying at home and we've been doing so good, let's be sure and lock in all those gains that we've made, and let's not lose all of the positive momentum that we've built. We can do both. Do you believe we can do both? Because you've got to believe. I know we can create this balancing act, but it's going to take a tremendous amount of effort on our part. I want us to focus, as I said, on protecting the vulnerable, our nursing homes. I want us to ramp up testing, and we are. All around us regionally, testing is going on, and our governor has made that happen for us. And he's scaling up our contact tracing. And so while he works on both the health and safety of our citizens, I will too. I join in that partnership, and I ask you to join me as well. I want to address one issue, and I don't want to end on a negative, so I'm going to have to address it, then pivot back to our positive message here of cooperation and in this spirit of caring for one another. But this weekend, our beaches were jam-packed. It's not a secret because they've been on everybody's Facebook, everybody's social media, every TikTok, every Snapchat, and every media outlet. And it's very, very important that you hear me say this. It has been a great blessing, I think, and a gift to be able to have our beaches open. And we want to continue to have that asset, that jewel of the coast, open to us. It's our right to be able to have open beaches in Texas. But we have got to do our part. But I know that we have a part to play in government as well. And so I have asked for a beach task force to be put together through our Emergency Operations Center. I just made the call to create a joint interagency meeting so I can try to get our federal partners, our state partners, our city and our county all working together. We've got to be able to do more to help people. Understand that the beach is there for them, for their wellness, for their enjoyment, but they've got to spread out. But you know what? I was on the beach on Saturday and Sunday observing and trying to figure out how we can make this better. And what I observed is that we need more access points. And also we haven't had rain. And so everybody was getting stuck. And so you saw all the jam-packed traffic because there was no way to get further down the beach unless you had a serious 4x4 vehicle. And so what I want to say is that I also have a responsibility to help you. And we are going to do that through our Emergency Operations Center. We have been absolutely at it all morning long before I went into court to try to find ways where we could do.
Coming up on Texas Parks and Wildlife.
The hunt test takes elements of duck hunting to see the skills that are necessary to be a successful hunting dog.
On the observation deck, I can also see lots of families doing it right. And it's no different than the way the stores are doing it right. And don't you want to be in a place where when you're patronizing a place that's creating that atmosphere of keeping you safe? I know I do. And so I want to tell you, while I pivot to amend the orders, I'm also going to be thinking long and hard this evening about the beaches, about the opportunity to keep them open, and recognizing the challenge it is to enforce what is almost unenforceable. And so I want you to know that tomorrow we will have a small announcement about the order before our press briefing, and I will make sure all of you are included. But we will have to work diligently this evening to make certain that we can achieve those goals together. So let me just end by saying that I believe that we have a tremendous challenge ahead of us, but I know it's one that we're up to the task to do. I have tremendous confidence in the collaborative effort that has been you, the citizens of Nueces County, and your emergency operations team, including our incident commander through the health director and our local health authority. And we got to keep it up. We have to absolutely not let our guard down. This is the time the enemy likes to invade. Do not let this enemy come in and destroy all of the good that we have accomplished together. I know that tomorrow will be an important day as we start planning for the reopening. And again, if Nueces County can assist in sharing the guidelines that have been developed on a voluntary basis here locally to make it a more successful transition for you, please let us know. Again, the number is 414-6000, and our email is county.attorney@nuecesco.com. There's so much to learn. Please make sure you know the do's and the don'ts, that you look at the guidelines. And you know what? Do more than. I challenge everybody, do more than the guidelines give you. Make it the most safe that you can make it. Never, ever settle for the floor when you can aim for the ceiling, particularly when people's lives are in the balance. This is my challenge to you. It's not an order. It's called leadership, and we all must exercise it. Thank you so much.
En resumen, esta tarde el gobernador anunció protocolos nuevos que estarán vigentes desde el 1 de mayo. Las tiendas y los restaurantes podrán reabrir durante la fase 1. Estos eran negocios que eran considerados no indispensables. Existen limitaciones, solo podrán recibir el 25% de la capacidad total de cada negocio. Queremos que nuestra economía mejore, por lo que debemos de seguir las reglas. En caso de que la situación cambie o empeore, habrán cambios nuevamente. La situación no regresa a la normalidad, simplemente se está tratando de hacer lo posible por reimpulsar la economía. Si tiene preguntas sobre estos cambios, puede llamar al 414-6000. Vamos a modificar nuestras órdenes para reflejar las órdenes del gobernador. Existe también un manual con las nuevas directrices y lo haremos disponible en nuestro portal de Internet. Continúe practicando las reglas sociales y de salubridad para evitar que los contagios aumenten, especialmente con la población de adultos mayores. Este fin de semana las playas estuvieron abarrotadas de gente. Es una bendición que las podemos tener abiertas al público, pero también tenemos que poner de nuestra parte. Vamos a crear un comité para las playas. Queremos que el distanciamiento social continúe. Sabemos que hacen falta más accesos a la playa, así que haremos lo posible para mejorar la situación en las playas locales. El día de mañana tendremos más información a este tema. Para más detalles, llame al 414-6000 o envíe un correo electrónico a la dirección county.attorney@nuecesco.com.
This is Joe McComb, Mayor at Corpus Christi. As the judge said, the governor has presented his reopening of Texas, and we're all going to follow suit on that. So by the end of this press conference at 6 o'clock, you'll have 78 hours left under the current orders. And we encourage you to maintain that. You know, the game's not over until the game is over, and so you still got 78 hours to respond and stay in compliance with the rules and the orders that are in existence today. But I was very optimistic in what the governor had to say. But the success of his program, he stressed more than once, is really the public's reaction to maintaining what we've been doing in the past. He's wanting to give us a little bit of room to kind of stretch our wings. We've been closed up for 60 or 75 or 80 days, and but it's going to be dependent upon what we do in terms of response. And the key to that is they're going to be obviously doing more testing. And one of the questions I think he was asking in his press conference at the governor said, obviously with more testing, you'll probably have more positive results, and that's true. But also, that's not the denominator or the fact, I mean, the determining factor in the decisions that will be made in the future, because I think what you'll see, at least in my opinion, I think when you get to comparing the number of tests versus the number of positives, you'll continue to see that percentage go down, and that's great for two reasons. One is that's fewer people being tested, and it will the forecasts that have been made in the past have been a little bit skewed, in my opinion. But I think you'll see you will see an increase in number of positives because you're increasing the number of tests. His goal for the state is to be doing 25,000 tests a day across the state, and that's a significant number. And I'm predicting that you will see some increase in the number of positives, but I'm also predicting that you'll see a substantial number of non-positives or negatives. So that's a good sign. But we want to continue to do that. And I appreciate all the emails and texts that I got over the weekend telling me that there's a lot of people on the beach and they weren't wearing their face masks. Well, I understand that and I understand the concern, but the rules are that we highly recommend and encourage the wearing of face masks. They are not a mandatory part of the orders or the rules, or they're not a requirement of the current rules or in the governor's rules effective May the 1st. So we continue to encourage you to wear your masks and use your masks, but they are not a requirement. But I appreciate being notified through the text and emails of the folks that aren't doing it. but it's not a requirement, but it's highly encouraged. The other thing is, and you might want to say, well, did Corpus Christi have any input into what the governor was doing? Well, he had a strike force that he put together from leaders across the state, and as you look over the names on that list, we had 3 people that have ties to Corpus Christi, and I think probably most of these names will be familiar to you. The first one is Jeffrey Hildebrand. He is the president and CEO of Hill Corporation, and they are the folks that bought the Sam Keene Beef Processing, now South Texas Beef, and he was on there, and he has Corpus Christi interests, so you can imagine he was there to express an interest not only from where he currently lives in Houston, but also because of his interest in Corpus Christi. Robert Rowling, former Corpus Christi resident, owns Omni Hotels. He was on the strike task force for the governor. And Sam Susser, here in Corpus Christi, who still lives in Corpus Christi, and he was there. So Corpus Christi was well represented in the input in the governor's plans, and we want to thank them for their participation in that and this Open Texas document that he's put forward. And so you can go, and it's a phase 1 is a real short window, but it's a good test. And it's a 2-week test to see what kind of reaction we get with people being able to serve 25% of their authorized occupancy numbers. And now if you think you don't have a participation, the governor's answer in response to a question, well, what kind of penalties do you have if they exceed that? Well, if you have a state license or a state permit and you're authorized X number of people in your institution, and someone files a complaint or someone contacts the governor's office or someone and finds out, well, your restaurant may have capacity of 100 and you've got 85 in there. Well, if that's the case and you have a permit or a license from the state, then that will be dealt with by the state. And if that is a license or a permit comes from the city, then we'll deal with those. But it's not just free reign, but we do put a lot of faith in the public's response to this, and we're going, the first 2 weeks is a 25% capacity, and if the numbers don't make a turn up, then that will be expanded to 50% capacity. And so you have an opportunity, and while we do a lot of requesting, it's going to be up to your response. You've heard the saying, you can lead a horse to water, but you can't make them drink. Well, we're depending on you we're leading you to the opening process, but if you want to maintain that open process, you're going to have to help us be successful there, because there was not any hesitation in the governor's voice, and I don't think you detected any in the judge's voice, that if the numbers go the wrong direction, we don't want to get back into another order at the governor's level or at the county level. So we ask for your participation. We got a lot of faith in you, and you've been wonderful so far. And so we just want to continue to request your participation, because it's, in the big scheme of things, another few days is a lot better than several months. So help us. You're picking up more of the load now in this reopening process. Now, one of the things that I did sign today was the order that's issued by the city that affects the city, and there has been basically the amendments to the city's order were updating what the governor imposed last time. That was allowing elective surgeries to commence. We just wanted to be consistent with all of the orders, and I think this actually happened after we'd had a council meeting last week, so we're bringing the orders up to date. I've signed those today. And the one exception that in the Corpus Christi order, this does not affect the county's order. It's not a part of the county's order at this point. The judge was kind enough in the order that the cities could make some decisions. The city of Corpus Christi made a decision. City of Port Arandis made a decision. It's not part of the county order, but it is part of the Corpus Christi order, and that is the portion, it's Article G in Section 1, that has to do with short-term rentals. And so, effective with my signing of this today, our prohibition about renting short-term rentals is now over, and they can begin to accept bookings and for the future. I don't know that it's going to have an impact between now and the next 78 hours when the orders expire, but at least it does let them know that those short-term rental prohibitions are no longer in effect. And that was with the signing of the order today. All the other issues in the order, the judge addressed the other items that related to the beach. Those are in the county's order, and she's going to be talking about that and bringing some more information about that tomorrow. So the public has been more than overwhelmingly supportive. We've always had a few that didn't want to play by the rules, but I can tell you, just repeating what the governor said in his press conference today, and I think the judge would support that, and I certainly would, because our number one goal is the safety and health of our community, is that if the numbers take a wrong turn, because we've been given this latitude to show how good we are in following instructions, then there'll be no hesitation about having to go back in. And then let me make one other thing. One thing that I think you will see is that there is nothing that in the governor's order or in our orders that say if you do not want to leave your house, you don't have to. That's a decision that you as each individual household makes. There's nobody there telling you to get out of your house now that these rules are coming into effect on May the 1st. So if you just feel comfortable staying where you are, that's fine until you get that comfort level to get back out and move around in society and go do your shopping or whatever you want to do. But this is going to be an opportunity come May the 1st that you can get out and begin to do the things that you'd like to do. We certainly continue to encourage the use of a mask when appropriate, to keep your social distancing up, because the name of the game is keeping people safe. I've got a lot of faith in the people of Corpus Christi. I think you'll be responsive to that and take advantage of this opportunity to show what a great bunch of folks we have here in our community. So we encourage you to do that, but we wanted to bring you that information today. And then the governor's orders, like she said, will take effect midnight on Thursday night, so May the 1st. These new orders take effect. But we'll continue to do our testing, and again, I'm saying this so you don't get excited if you see the number of positives increase, because really the telltale sign of the significance of the virus is, and one of the key factors I think the governor indicated they were going to be looking at, and his advisors was going to be hospitalizations, because we've been able to keep our hospital numbers down, and capacity is out there. We've got plenty of capacity, and we hope we don't have to use it. But as long as that denominator gets bigger and bigger, and the numerator on the number of positives doesn't increase significantly, I think you're going to see that indicates that there's, on a wide scale, a small percentage of people that do have it, and then we want to make sure that they're protected and the rest of us are protected. So thank you for your participation and your support of these rules, and we would ask you to stay vigilant between now and May the 1st, and then particularly after the 1st, where the burden is going to be more on you than the governor or the county judge or myself. You will be making the determination of what kind of decisions will be made after that, depending on what we see in the terms of the response to the increased testing. And we want to thank the governor for allowing this increased testing, and to see where we go on this. We can all come out winners, but we're going to have to work together. So thank you very much, and enjoy the weather. It's wonderful out there. And so just keep your social distancing and behave yourself, and we're all going to get through this together. Thank you.
En resumen, el gobernador anunció que se realizarán más pruebas, hasta 25,000 al día, por lo que con más pruebas habrán más resultados positivos al virus. En las playas los visitantes no estuvieron usando tapabocas y aunque no es una orden, le exhortamos que los use cuando esté en público. Comenzará la fase 1 para la reapertura de negocios, aceptando a no más del 25% de la capacidad total de cada negocio, al menos por las primeras 2 semanas, esperando aumentar esa capacidad al 50%, siempre y cuando se sigan las órdenes, por lo que pedimos la participación de los residentes. Hoy firmé una orden en donde están los cambios ordenados por el gobernador en cuanto a las cirugías selectivas. También vigente desde hoy están aprobadas las rentas a corto plazo mismas que se habían suspendido hace varias semanas. El público nos ha ayudado mucho con su participación, pero si las cifras por el virus aumentan, podremos regresar a las órdenes anteriores. Si usted no se siente seguro de salir de su casa, no lo haga. Use un cubrebocas cuando salga y eso evitará contagios. Las órdenes del gobernador comienzan el 1 de mayo a primera hora.
Okay, just two quick closing things, and then we'll see if there's any questions. So one is the judge referenced the governor's manual. This is called the governor's report to Open Texas. And Judge, I know you've been busy all day, but this is on the website already. So it's on the city-county website. We have a joint website that puts all our COVID information on there. So you can access that website by going to nuecescounty.com or gov, I think, or whatever the county website is, or the city's website. Just go to the main homepage, and there's a link on each of our websites for our COVID page. So this document's available. It's pretty lengthy. It has a page for numerous different types of businesses, schools, government offices. It tells us how we should reopen as we reopen in this approach that the governor laid out. So that's available. And then secondly, tomorrow, since we just got out, the governor just had his press conference. We're still digesting it. We just got his orders. We have his 3 orders that he has, so we're going through those. And so I say that to say that the city will respond as well. We have 32 lines of business, and we've closed offices, we've closed libraries, we've closed swimming pools. We have to reopen consistent with the recommendations and the orders of the governor. And so we're going to begin to announce that tomorrow on what we reopen and in what way. So as an example, the governor's allowed us to open libraries on Friday. Are we going to open them all on Friday? What's the hours? How many people can go in? All that has to be worked out. We've been slowly getting ready to get to this point. We don't have all the information today, but beginning tomorrow, we'll begin to communicate to the public on our business, the city business, and the county business as well. I'm sure the judge will be doing the same. And so we'll talk to the community. There's going to be a lot of nuances, so it's important the community pays attention because some things that you may think would stay open will not, or some things that could open up will not. So as an example, when you read the orders of the governor, and he didn't mention it verbally, swimming pools are not to be open, right? So the city has a natatorium, we have the Collier pool, we have swimming pools, and those will continue to remain closed at this phase of it. And so these are some of the nuances we have to explain to the community. And things like the 3 museums along the bayfront, we have the Art Museum, we have the Science and History Museum, and then the Art Center. We'll provide information to the community tomorrow on those. We have the Lexington, and we have the aquarium. And so I've been in contact already with the aquarium CEO, and he may want to open on Friday. We'll get more detail from him tomorrow, Wednesday. So I just want to point that out to the community that we have businesses as well, which a lot of our viewers use and utilize. And we'll begin to share information with the community on those openings as well. Judge, did you want to say anything on your businesses real quick? Okay.
Just going to echo that too.
Okay.
From the county perspective, I think you said it perfectly.
Okay.
I just want to, when you get these orders late in the afternoon at 3:30, you do need time to digest it. And for me, we sent people to work remotely before we had a stay-at-home order. And so we didn't get here overnight, and I'm not going to unwind overnight when it comes to county work and county employees. We're all working. We're just working differently. And so I think that what we need is time to reevaluate how we will open all our county facilities. And so you may see, maybe me push that, until next week rather than this Friday. We have to have time to get employees back on a schedule, and we have to have a chance to really put the protocols in place. And I'm going to be honest with you, some protocols cannot be done in 3 days' time or 4 days' time. So you may absolutely see an opportunity for us to take a couple of weeks to really put the right protocols in place so that when we deal with the public, that we have a protection mechanism there, whether that's plexiglass or whether that's, making certain that we can train everybody on the proper protocols when you're handing somebody money or handing somebody a transaction. So I just want you to know, just like you said, Peter, I'm thinking the same exact thing, and it's not just a recreational, arenas, it's also the workforce arena. And we've also proven to ourselves that we can work remotely. It might have been really hard week 1 and week 2, but now that we're in the groove, I don't expect to just completely reverse course and say, okay, it all has to be done tomorrow, or at the end of Friday, from the county's employment perspective. So give me a chance to work with our council and with our partners at the city, and I bet, by the end of the week, we can come up with a very good plan to announce to everybody.
Okay, okay, great. Thank you, Judge. Okay, so that concludes our press briefing for today. We can take any questions that y'all might have.
I've got one.
Okay.
The mayor kind of addressed it, but I don't know if either one of you can answer this one. We have counties like Brooks County, Bear County, and Alice enforcing the face mask policy and doing some fines. How come Nueces County
Let's have Judge talk to that.
can't address that?
Okay, so the question is about masks and whether or not there's an enforcement capability. Some counties, you point out, are enforcing, and we're not. Well, first of all, let's say I do not have a mask order in place at all. Having said that, today the governor has made it very clear that there is no enforceability provisions for masks. So any county that is enforcing that provision or that order will have to cease doing so. So having said that, we highly recommend wearing masks, particularly in public spaces, particularly when there's a real expectation that you won't be able to social distance. And think about your big box stores and think about your big grocery stores when I'm talking about that. But I will say that when I do amend orders, there was a good discussion today in Commissioners Court about mask wearing and about where it can make sense and where it's smart. And we discussed public transit today. Some commissioners felt that it was not needed to be mandated. Others felt that it was. The RTA came in to say they would like it mandated. So that's one arena I'm going to be looking at as I create these new amended orders. But there will be no enforceability because that governor has already made that declaration, okay? But you know what the enforceability is each other. Again, just like the mayor said, you can do your part. And there's times where it's smart to wear a mask, and you should do that. And I'm going to highly, highly encourage, if you are a member of the vulnerable population, you should wear a mask, not because I say it, because the CDC says it. And they are the experts in this arena. And yes, they change their mind, but don't you want them to give you the best advice based on the best science at the right time? And they say you should do it. So I think that's where we need to focus on, is not whether or not I can make you do it, but whether you should do it.
Okay, any other questions for today's briefing? Okay, very good. Well, thank you for being here. We appreciate you getting the information out to our community. We'll see you all tomorrow.